Thank you, Pat and Brian. Before we begin the topic today, we want to revisit real quickly a topic from our last Power Breakfast where we talked about the new federal health care legislation. The main conclusion from that discussion was the best thing companies can do to contain their health care costs is to have a healthy workforce. To that end, the Business Journal has been working with New Hanover Regional Medical Center, Wilmington Health, Atlantic Orthopedics, Greff and E-Step, and Wilmington Athletic Club to create the Fittest Execs program. The goal of this program is to challenge executives to work on their own personal fitness to help spread the message of the importance of fitness throughout their organizations. More information about this program is at your seat, and I'd like to ask one of our model execs on that sheet, Jack Bardo, to take a couple minutes to share his experiences going through a similar program with other executives at the hospital.
Thank you, Rob. Good morning, everybody. If you ever wonder if Brian McMurdy is successful, he was retained by Rob and to go find a fitness model, and if you can see in front of you how successful he was in that process, continuing the humiliation of my life over the last few years. It's almost a year now since we started doing this as a group of 10 or 11 or 12 of us. A lot of them are sitting right here, and health transformation, it's really been remarkable. Not our fitness levels have gone through the roof, but also our health status. Our cholesterols are all down, our triglycerides are down, our body fat's down, blood pressure's down, people are off medications, we're saving money from that process. And at the end of a year, what it's really done for us is the camaraderie amongst the group has just grown exponentially throughout the process. I mean, we enjoyed each other before, we liked each other, but we have an event or two that we do each week. It's an amazing amount of fun, and we've had a good time doing it. We actually are going to roll that out. We spend $30 million a year insuring our employees and their families. So for us, again, probably being the largest, not only receiving insurance but paying it, it's an enormous amount of money for us. And we've decided that this year we're going to roll it out to our employees as part of the process, taking some of the things we've learned, but also continuing to do it. Our goal is to reduce 10% out of our health insurance budget over the next few years by changing individuals' lifestyles. You're talking about $3 million. You're starting to talk about real money to go through this process with the investment. We're going to put every employee this year who's insured by New Hanover Regional Medical Center will mandatorily have to go through a health assessment where we can get a baseline health on them, but also more importantly on our entire workforce to know where we're going to spend time. If you do not do that, then you'll pay more for health insurance than the individuals who have gone through the assessment out of that process. If you're not insured by us, if you're insured by one of your family members on that policy, we'll still put you through the health assessment if you choose to do it, but for them it's voluntary because we're managing it through that. We're also then going to put a series of support groups together to teach people, depending upon where they are, entry-level exercise for people who haven't done anything in 30 years, and also being able to make sure that we support individuals on the other side who are out there every day. Dietetic counseling will be important. Chronic disease management support will be important when we identify individuals who have congestive heart failure. We know we will identify a number of individuals who are walking around that are diabetic or pre-diabetic who have not been diagnosed because they haven't been to a doctor, they haven't taken care of themselves out of the process. We know we'll find individuals who are hypertensive that aren't controlling their blood pressure. As a self-insured, we want to make certain that we give them the dietary counseling, the exercise support and counseling, but also the support to make sure that they manage their medications during that process and take them and track them and make sure they're doing the right things. Because with that, they're going to lower their risk. We're going to hopefully save money. Last year we did not mandate, but we really pushed hard, and we had 97% of our employees to go through and either get their flu shot or do a declination, which said that they understood the impacts of what it was, and about 8% chose not to do it. But we also with them made certain that we made sure that they took appropriate precautions in that process in that 8%. The reduction in sick days last winter, one of the worst winters we've had for flu seasons in a long while, was remarkable. The equivalent of approximately 3 FTEs during a 3 to 4 month period. Doesn't sound like a lot, but couple it with the fact that people had to work short, Didn't have to work short. We didn't have to pay overtime for individuals coming to the table. We've mandated that it's a requirement for every employee to have a flu shot this year, unless you're allergic or unless you have religious reasons against it. And if you don't have it, you won't work until you get it, because that's also a pledge to our patients that we're going to take that precaution. But secondly, it's an economic thing that also boils down that you're not doing that. So with that, I think it's time to come back as we've looked and manage this aspect of our business that we haven't been managing because we haven't wanted to, in many cases, infringe on people's rights, get down into that level. But what it really boils down to, it's a commitment we make to our employees because, one, we've managed through process changes to keep our health insurance plan flat for the past 7 years for employees. If we're going to do that, we better cut utilization out dramatically out of the process. And in today's environment, that's all money that they keep in their pocket and can spend into businesses throughout the Wilmington area. So it started with the executives. You can't ask people throughout the organization to do it if you're not committed. We're going to try this with our employees for a year. We're going to track the results, publish the results. Hopefully, Rob will let us come back in a year. We'll let you know what we're going to do, and at some point, we'll be able to support other businesses in the community who wish to do this as well, because we think with what's going on, I think this is one of the #1 things missing from any health reform legislation that's out there. There is nothing out there for prevention, lifestyle change. It's insurance reform. So since it didn't get mandated by our government throughout that process, we have to take it on because we're still going to be spending the money for it. It's not going to come from businesses through the government. It's going to come out of our pockets. And I think we need to figure out how we're going to do it. So again, Rob, I appreciate the humiliation. I've told him I would do this, but I get editorial license on one thing, so we've just destroyed the entire journalistic integrity of the Wilmington Business Journal today. Only kidding, Rob. You're still there. But we want to do it, and we hope it'll be fun. And you know what? If anybody has questions about it for your employees, call us. I know that PPD's been doing this for years. There's a lot of track record in town, and let's see what we can do to run it out. Thank you very much.